Hi, this is Dr. Eric Hussey, and I spend a lot of time in my practice diagnosing a condition called intermittent central suppression. That's a condition where one eye's picture drops out for 2 or 3 seconds at a time, and it's been shown to be a problem with reading, as you might well imagine, as eyes go on and off, and as people are trying to have a stable image to read with. There has been some dispute, or maybe non-understanding is a better term, in the literature of what intermittent central suppression is and what it does, what it means. So I thought I would go into a bit of a nerdy explanation of the literature and intermittent central suppression and why there is this difference of opinion to some degree in the literature. So when we look at the conventional wisdom on suppression, suppression again is where one eye's picture drops out. The conventional wisdom comes from crossed eyes and from amblyopia. So amblyopia is lazy eye, and so where the conventional wisdom comes from is one eye's pointed like this and one eye's pointed like this, and so the brain doesn't want to put up with that, so it shuts off one eye's picture. Or in some forms of amblyopia, there's a big difference in the power of the two eyes. So one eye is pretty normal, if you will, and the other eye is way farsighted, or farsighted and has a bunch of astigmatism, something like that. And so it's very hard to put those two things together in the brain, those two images together in the brain, to make things make sense, and so one eye's picture drops out. Those are the easy ones to explain. Way back, they used the term diplopia-phobia. Well, what in the world does that mean? Diplopia means two eyes, or two pictures, and phobia means fear of that. And so diplopia-phobia was a term used by one of the famous people in eye care named Bielszowski, and it was to say that the brain is afraid of having two images that don't go together, and so it shuts off one eye's image. That's fairly easy to explain in a theoretical sense. The ones that are hard are the people whose eyes are straight forward, and and the powers of the two eyes are equal. So where does this? How do we get into something like diplopia-phobia or something like that? Very difficult to explain. The other things that are difficult to explain with the theory of diplopia-phobia is intermittent central suppression, as the name implies, is an on-off condition. And so both eyes are looking ahead, and so one eye's picture drops out, then it comes back, and then the other eye's picture drops out for a few seconds, and then it comes back. May switch right, straight, back, and forth. Very difficult to explain in terms of the brain just not wanting to put up with one eye's picture, since they're both essentially the same. And also difficult to explain, I've diagnosed this showing up in somebody who had whiplash. So somebody whose head gets knocked around like this. No other changes in terms of visual fields, what they could see, anything like that. But all of a sudden there was a suppression there, a dropping out of the picture. 80 to 90% of the time, suppression in intermittent central suppression in ICS, 80 to 90% of the time it alternates eyes. So how do you explain that the brain says, oh, I'm afraid of this eye's picture, well, now I'm afraid of this eye's picture? And those are all difficult things to explain. If we look at the classic diplopia-phobia explanation for suppression, well, if all we do is move the suppression where the thought is that diplopia-phobia occurs is back here in the visual cortex, and the mechanism by which one eye's picture is interfered with or is inhibited is called masking, and masking has to do with the timing of images getting to one side or the other, and you literally can block one eye from seeing by timing an image on the other side at just the right timing. And that's all well and good. What the recent research is showing is that masking back here really isn't all that strong. Where is masking strong? Masking is strong right about there, right about halfway up to the brain at a structure I've talked about before, the lateral geniculate nucleus, the LGN. And what happens at the LGN is if there's a difference in the neurological signal carrying motion between the two eyes, and usually in all of this, this is a developmental thing. It's not an active pathology. In kids especially, I look at it as a developmental thing. Again, I have diagnosed it showing up in whiplash, so there's always the possibility that there's trauma involved, but it's not an active pathology, as I tell parents all the time. There's nothing inside munching your child's brains, you know. But it's a difference in the strength of the motion signal, as motion is the on switch for everything visually, and so if that signal is not strong enough, then one eye's picture drops out. Well, as that eye drifts a little off target, what happens? Well, the motion of the drift increases, and boom, that eye's picture comes back. That's kind of the sequence of events there. And so the diplopia-phobia theory, if you will, of suppression doesn't explain what we see in intermittent central suppression. And that's an important thing to know if you do get your child checked out and you start talking about something like suppression, and the doctor says, no, he doesn't have a crossed eye, he doesn't have an amblyopic eye. That doesn't matter for intermittent central suppression. In intermittent central suppression, literally everything is normal with the exception of how the picture gets through from the eye up to the brain. There's one other thing that the conventional wisdom will say about suppression, and that is that we suppress all over the place, that we're always dropping out images all over the place. That was disproven pretty effectively in a paper by a researcher who the lead researcher on the paper was named Liversedge. How could you ever forget a name like that? And he showed that no, in fact, that doesn't happen, that the image is not dropping out all over the place. So intermittent central suppression is something that creates confusion in the central vision, and if your central vision is confused and unstable as eyes are going on and off, things that require detail and consistent detail can be messed up. And that's the confusion that we see that interferes with reading. And what I showed in one of the studies we did on Job Corps kids was that if you straighten out the intermittent central suppression, if you straighten out the ICS, or at least reduce it, then reading improves. And it's not anything magic, it takes time, but reading improves because now you've got a stable, secure, non-varying, and let me use the term normal image coming from the eye up to the brain.